Think we've got people joining us now, folks. So welcome for those of you that are joining us. We'll just give people probably another 30 seconds or so. And then when the number of people joining slows down, we'll start the webinar. Just getting the slides organised now, folks. So folks, if you've read the slide there that's up, you'll notice that we've asked you to just introduce yourself in the chat. We're really hoping for a very lively chat today. So I'd love it if you just pop into the chat. So down the bottom there, you'll see that little icon that says chat. And in there, you just put who you are. If you're representing any organisation, it's really great to know I'm representing this organisation. We love to know whose country you're on. I'm in NAM at the moment, so do share that with us. And also what your pronouns are so that we know how to address you respectfully. So there's 42 people, so I'm hoping for 42, 43 comments in the chat shortly. So just do that while we wait for the last couple of people to turn up and we'll get started. So good on you, Shannon, for starting the conversation in the chat. And thank you, Murray, for adding your name in there as well. And Sabine, fantastic. So keep them coming. Let us know where you're from, what your pronouns are. If you're representing someone like Giacomo from CHF, fantastic, letting us know. That's really helpful. So we get to know each other a little bit in the chat. Thanks, Carolyn. So keep those coming. So I've got 6. I need another 37 yet. So keep going. Let us know who you are, where you're from, what country you're on. It's all really fantastic. It gives us a sense of being in the one room together. While you're doing that, I'll just give you a reminder that AI scribes are only permitted for accessibility purposes. So unless you've previously got permission from us for your scribe, we won't be expecting to see it pop up, and we may remove it if it turns up. I'd also like to acknowledge, I did say that I'm in NAM, so I'd like to acknowledge that I'm the land of the Wurundjeri people, the Eastern Kulin Nation, and I'd like to pay my respect to their elders past and present, and also acknowledge their continuing relationship to the lands here. I'd also like to extend a special welcome to any Aboriginal and Torres Strait Islander people who happen to be joining us on today's call. So that's great. We're halfway there, folks. There's only 26 more of you to put your names in there, so that'd be fantastic. Keep on going. That'd be great. Thank you. So I'm going to get us started into the webinar now because it's really such an important topic. We've seen over recent years how severe and frequent storms and other weather events, they're becoming more frequent, these things, and they can sometimes lead to blackouts. And we know that many thousands of Australians are deeply impacted by these blackouts because they actually rely on that power to keep their medical equipment working. So we've seen evidence of this recently and how it can play out in Broken Hill and the surrounding areas where power towers were destroyed by a tornado in October. Some of you might have seen that news. That meant they needed generators. The generators didn't always work as well as we might have liked and created a lot of issues and no doubt a lot of distress for people. And I really want to acknowledge particularly that community today and all the resilience and the work they've done. Really pleased to see that that's improving and the restoration works are almost complete. So just to acknowledge that. And, you know, as we've seen not only in Broken Hill, for some people, the power going out is really a life or death matter. So it's a very serious topic that we're talking about today, and we recognise that. And we're cognizant of the fact that sometimes it can be a bit overwhelming to hear those stories. So I want to just reassure you that today the plan is to calmly explain and use the wisdom of people with lived experience and people whose professional careers are in this space to help give you some advice about what to proactively do to keep yourself well if you should find yourself in a situation where the power supply is not as stable as we'd want it to be. What we're hoping is that you'll leave today's webinar with new information that allows you to make an informed decision about how to look after yourself, putting your plans in place, or if you're supporting someone who requires access to powerful medical devices, the kinds of other things that you might do to support that person. But if you are distressed, Shannon will put a slide up in a moment now on for you with the information of how to get access, thanks Shannon, to Beyond Blue, and there are other places which you could connect with if you need to talk to someone after the session. Terrific. So I think we've got enough people here to get well and really started. I'm just going to, my maths is pretty good, so I'm just going to say we've got 32 people who've said hello in the chat. So we've got another 20 that need to go into the chat. Say hello, which country you're on, your pronouns, if you're representing anyone or you just want to say good day and tell us the weather, whatever you like. We love to hear from you. Thanks, Shannon. And we also have got the emojis that you can use, the reactions. These are a bit fun to use during the session too. So can I just ask everyone to go to that react icon that's just to the right of chat, pick a random emoji and pop it in. There we go. We've got a thumbs up and a heart and some party poppers. Anything different people would like to put up? Lots of hearts and claps and party poppers. Oh, and a surprise face. Fantastic. Love that. So keep going. So everyone, love you to just try that. Try as many of them as you like. Okay, so you get a sense of it, because as we're going, when we've got speakers, I'll ask you to thank them and I'll ask you to use the emojis to thank them. If someone's talking and you support what they say, do this. Put up your hand with you know, a heart or a smile. If something concerns you, put your surprised face up. It helps us get a sense of how you're feeling about things, and also gives you an opportunity, if someone's speaking, for you to show your support for what they're saying. So we're delighted to be bringing this webinar to you today, and we're doing it in partnership with our friends at the Energy Charter. And we do have a speaker from the Energy Charter who will be able to explain what they do, but I just want to say it's really great to be doing this in partnership with them today. So we're going to spend some time listening to the wisdom of some consumers who live with medical equipment and have been working with the Energy Charter through a lived experience panel that CHF helped set up. And then you'll hear from the Energy Charter about the great work that they do, and we'll hear from a representative of the energy industry about the work that they do to help support life support customers during blackouts. And then finally, at the end, we'll have a panel discussion. So we've got a Q&A box there. You might have discovered that already. We love you to put your questions into the Q&A box, and Shannon will remind you of that. If you put a question into chat, she'll often say, could you put that in Q&A? If you've got a question, you can put it in there right now. I'll keep encouraging you to put your questions in, because at the end we'll have some time for questions and answers. We don't always get time to answer them all, depends how many questions there are, but they're never lost, because we use them in further conversations, in advocacy, in knowing what we might need to include in materials, or advising others about information that they might like to provide to people who rely on power for medical equipment. So all of your questions are great. They're always really helpful to us as CHF. We love you to put all your questions into the chat. And into the Q&A, depending on the best place for them. And as much as possible, we'll answer them. So we're going to start by asking you a question. I'm going to run a little poll today. We want to get a sense of who's here and what would be most useful for you to hear. So we're going to ask you a really simple question, which is, what best describes you? And you can tick, I live with medical equipment, so you know I'm reliant on that, or that you care for someone, or that's not why you're here, you just got a general interest in this topic. We'll show you the answers in a little while, and I'll give you a few seconds to just pick one of those. I'm either reliant on or live with the equipment, or I look after someone, care for someone who has a need for that equipment, or that's not me, but I do have a strong interest in this topic. I'll give you a moment to do that, and a little later on we'll share that with you. Great, thanks very much. We'll come back with those results in a little while. And again, fantastic to see we're getting there, 37 people in the chat. We still need probably another 10, 15 to just introduce themselves. You can just look in the chat, see what other people have done, and do the same kind of thing. And also just remind you, we're really open to all of your questions and ideas. We do encourage you to be respectful. If you've got a question, try and make it as clear as you can so that we can give you a really good answer. Okay, so let's get on with the main show because really I'm just here to introduce our two amazing consumer representatives, Adam Johnson and Carolyn Campbell-McLean. So they're doing some just amazing work, and you'll be able to see from their bios, which we're going to pop in the chat, that they have an absolute wealth of experience. And you can see they're also the chair and the deputy chair of this important panel that the Energy Charter has kicked off. So first of all, I really want to thank Adam and Carolyn for joining us today. And I'd love you to introduce yourselves to the audience. So perhaps we'll start chair and then deputy chair. Adam, would you like to just say a couple of words?
Look, thank you everyone for coming along. I do appreciate your time and that everyone is busy, but as Elizabeth has just said, this is a vital project for a lot of people. And I'd also, before I begin, like to thank both the Energy Charter and the energy companies who are not only supporting better outcomes for those who are in serious need of, of equipment and life support equipment, but are streamlining and targeting their systems so that all of those people get better outcomes. So I'd like to thank both the Energy Charter and energy companies who are very heavily invested in this and have been for a long time. Next slide, please. I've had the privilege of chairing a panel, and I say the privilege because all panelists come from immediate lived experience. They're consumers of energy like all of us, but they have specific medical needs, or they have a loved one with specific medical needs, and they've told sometimes very harrowing stories of the difficulties they face when the power goes off. And I'd just like to acknowledge the strength and the wherewithal it takes to share sometimes life and death stories, sometimes which have ended in death, but often which have, because of the intervention of others and because of the intervention of providers, have resolved themselves, at least to a certain extent. So there has been good stories, there have been bad stories, but they've all been vitally important stories to inform our work and to bring all sides closer together. Next slide, please. So the reason I joined this panel was that I had an experience some years ago of 5 days without power. And I suddenly realized how every piece of equipment I relied upon energy, relied upon power, and how batteries failed within 2 or 3 days, and how difficult life became. But when I joined the panel, I realized I was far better off than many. At least I could still, breathe without assistance. Yes, after 5 days, I was in a lot of pain, not being able to lie appropriately, not being able to sleep appropriately, and things like that. But I had a uh, Damascus moment and was confronted with reality about people who are living and fighting every day to ensure that the very means of existence continue to work. So I take my hat off to those who were prepared to work with me and work with the Energy Charter and energy company representatives to put together what I will say to you is a better system, is a scheme that I hope you will have confidence in and that you will engage in, not only for your health, but to give confidence to others and to give the energy companies the ability to better service you at the times when you most need them. Next slide, please. our aims are listed exactly there, and it was to emphasize the lived experience and what was critical in our needs and what were the critical values or concerns that we had, which was why, as will become clear later, we streamlined and worked on definitions to highlight those most in needs and the nuances that we wanted all parties to be aware of in our care and support, so that we could actually assure people that we would have a workable system that would not be overwhelmed, but would be targeted to meet the needs of those most in need, acknowledging that there will be power outages, but as this new scheme rolls out, we will be better equipped to respond and protect and uphold those who need power restored the most. Next slide, please. Again, this is the membership of the panel. Again, we tried to be as broad-based as possible because we didn't want to exclude anybody. We didn't want to miss anything that was important. And we checked in with each other regularly. And again, I'd thank the Energy Charter for this, because we were dealing with things that were confronting, things that were emotional, and things that had real impact and real meaning for each individual member. And again, I'd like to thank the Energy Charter for their commitment, and I'd like to thank each member of my committee for their commitment to keeping on through many months of meetings, dealing with, as I've said, and I'm going to say it again, confronting personal issues, confronting personal stories, which they were prepared to share in a room and an area of safety, but which were vitally important to us understanding the needs as a group and being able to give properly considered advice to the Energy Charter and energy providers. And I just say again, I cannot say enough for both all of the members and my deputy chair, who again stepped in at times that I could not, and has been the most supportive and capable deputy chair I could have asked for. And she also enhanced and built in mechanisms to check in after meetings to ensure that everybody was travelling as well as could be expected. So thank you, Carolyn. Next slide, please. Our work so far. So let's jump quickly ahead so that I'm not eating up too much time. Oh, now Carolyn will be presenting her story. Carolyn?
Thanks, Adam. Elizabeth, shall I go on now?
Yes, please.
Yeah, sure. Thanks, Adam. Thanks for giving people a bit of an idea of the work that we're doing. Hi, everyone. My name's Carolyn Campbell-McLean. I'm a social worker and I currently work at Muscular Dystrophy New South Wales, which is the community group that I'm involved with. I run a Peer Connect program there, and so I provide education and social opportunities for people in our community and trying to get information out about all sorts of different topics. But yeah, I wanted to talk today particularly about why I joined the lived experience life support panel that the Energy Charter is doing, and that Adam so eloquently explained to everybody. Yeah, I guess I'm a power chair user myself, so I've always been Carolyn in the wheelchair, so I've used a power chair for over 35 years now, and a lot of medical equipment going along with my disability. So I use an electronic bed. I have a hoist that helps me get in and out of bed. I have electronic front door so I can independently get in and out of my home. And I also have a BiPAP machine that I rely on to help me breathe overnight. So there's a lot of medical equipment that I'm using as a person with disability at this point. And I know a lot of people with disabilities use a variety of different equipment that really is very important and essential, as Adam was saying. So yeah, also my story, I just wanted to share with you that how I got involved with this work that we're doing on the life support panel is really through my own personal experience and my lived experience some time back when I was living with my husband, Danny, who also had muscular dystrophy, and he was very reliant on his ventilator overnight. And unfortunately, we had a very big storm one Sunday morning at 6 a.m. and all of the power was cut out to the home and the whole street and suburb after a very big storm. And so unfortunately, the backup battery that was in Danny's ventilator did not work. It did not kick in as it should have in the event of a power emergency. So I was calling the neighbours, calling the ambulance, and unfortunately, because we had an electronic front door, that also wasn't working. So that was another barrier that with the power being out, it was harder to get people to come into our home and support us at that very moment that we needed help. So basically, unfortunately, Danny was taken to Westmead Hospital in Sydney, and you know, he was on life support, but because he was already weak and with his muscular dystrophy, he we had to make the heartbreaking decision to turn off the life support for him because he suffered such a hypoxic brain injury due to not being able to breathe that day. So it was a very, you know, it feels like yesterday, it's some time back now, but ever since then, I guess I've thrown myself into my work in the advocacy space and trying to make the world a better place for people with disability. And one of the projects that I'm really happy to know that is happening now is the work in this space about what you do when the power goes out, when you're very reliant on, you know, medical and disability equipment. What do you do when the power goes out? You need those things to function, to live. So what we're doing now on the panel is actually trying to come up with ideas about how people can create backup plans. And I'm very keen on awareness for everyone in the community, you know, people with disabilities, but also their families and carers, and also everyone that's involved really. So the you know, energy companies, you know, first responders, neighbours, everyone involved, I guess. I think it's really important that everyone has a role to play in creating the awareness that we all need to have a backup plan for emergencies. So yeah, that's some of the work that we're doing on the panel at the moment. Yeah, so I think yeah, that next slide. Thank you, Shannon. I think that I wanted to explain to people. Thank you for your hearts in the chat. That's really beautiful. Yeah, I guess, you know, turning such a tragedy situation in my personal life into some work that we can do. You know, my goal is to make sure this doesn't happen to other people and other families. So, you know, if I ask for anything today, I ask for someone just to have conversations with people that they know in their community, in their family, to make sure that they are aware that it's really important to have a backup plan for power outages, particularly for people who are disabled or who are aged and rely on these kinds of medical devices. So some of the work that we're doing is that we've been able to look at the actual definition of what is a life support customer. And so that's been quite good work, because like it needs to be a definition, because otherwise it can be quite unruly. You know, you would have everyone saying that they need the power, they need the life, their life support customer. So we've actually had to look at what that means. And so we've come up with the definition that a critical life support customer is a person who requires continuous power supply to their life support equipment operating in their home to ensure that there is no loss of life or lifelong irreversible injury. So that's very important for the power companies and to know, because if you are registering to be on the life support register, that is important that they know that it's the right people registering onto that register. So we got a lot of great feedback on the panel about that definition. And, you know, it's great to know that we've actually had some change in the legislation, because the rule about that definition has gone into legislation now. So that's really a great step forward. There's lots more work that we're doing. Thanks, Shannon, for the next slide. So some of the work that we're doing now on the lived experience panel is that 3 of the members of the panel are working really hard on the development, co-development with energy providers and energy businesses, retailers, so that they're working on like a template, so that everyone can have a backup plan template. It will look different for everyone, obviously, depending on everyone's circumstances, what equipment they have, where they live, their social support network, and so on. But to have a template so that people can start thinking about their own circumstances and making sure that everyone in their life, their support workers, their neighbours, their family, everyone involved is aware of the backup plan and what needs to be done in the circumstances when there is a power outage or a blackout. And the other thing that we're working on at the moment we're doing in co-development is the National Awareness and Education Campaign. And that's a really great idea, because I think, you know, there's been a lot of great campaigns out in the world. You know, I always think of the things like Driver, Survivor, Reviver, you know, that sort of thing, or the ones at the beach, you know, for water safety, fire safety and things like that. So we're trying to work on a campaign that can ensure that people who need this kind of life support equipment can easily identify the things that need to be done and the people that need to be contacted in the event of an emergency. So stay tuned. We're going to come up with something really easy to remember and easy to spread, so that we can actually make sure everyone in Australia knows about our campaign, and that there are no more tragedies or no more deaths from power outages if we can help it. Yeah. And the last, I think that's my last slide, Elizabeth. So yeah, I know we're going to have a little chat later on, but I'm really, you know, happy to help answer questions or help provide information. I love information and support for people. I know that a lot of the work that we have done in the lived experience panel has been difficult conversations, but I think, you know, turning those difficulties into positive things that we can take action on and then we can be prepared. It's a bit like when the bushfire seizing or changing your smoke detectors, you know, all of those things are really, really important. So I think it will be great when we can get this information out and ensure that everyone who is a life support customer has a plan of what to do in an event of an emergency or a power outage. So thanks, Elizabeth. I'll pass back to you.
Fantastic, and thanks to Carolyn and Adam for their great presentation. I'd like to encourage you to thank them using your emojis. Let's give them an emoji storm there, folks. Let them feel the love, okay, both of you. It's a good feeling. So we will be coming back and we'll be asking Adam and Carolyn during the presentation for their thoughts on the other presentations. So thanks for that, but we're going to come back to you shortly. And just before we go to our next speaker, I'd like to show you the results from the poll up on our screen. So we asked, you know, how are you involved? So we can see that we've got a lot of people very interested in this topic here today. Less people who are actually using or caring for someone with the equipment. That's really interesting to see so many of you with a general interest, and I know some of you professionally having an interest in this space. Terrific, and hoping that what you learn you'll be able to share with the people that you work with and any customers or clients you have as well. So that's really fantastic. So we're going to now move on to our next speaker. So I'm really pleased to introduce Sabine Hyden, who is the CEO of the Energy Charter, the organisation we've been talking about. We'll be popping her bio in the chat. You can see she's got very impressive experience and a really great person to be leading this work. So Sabine's going to talk to us about what the Energy Charter is, how they work with consumers and energy companies and so on. And as she's talking, I'd encourage you to keep putting your questions in the Q&A and your thoughts in the chat. So over to you now, Sabine. Thank you.
Thanks very much, Elizabeth. And I did want to start off with just thanking sincerely Adam and Carolyn for sharing their stories. My name's Sabine, as Elizabeth's mentioned. I'm the CEO of the Energy Charter, and really grateful to be here today. And thank you again for everybody's time. If we could just move on to the next slide. I too want to acknowledge the country that I'm beaming in from, and that's Garramargal country, and pay my respects, and of course pay respects to any Aboriginal or Torres Strait Islander folk on the call. Thank you for joining us. I also want to acknowledge those with lived experience of ill health and recovery, and I think Adam and Carolyn have really set the tempo for the energy sector. The notion of lived experience is a relatively new notion. Having a group of people that have been so incredibly generous with their sharing has been really, really important in all of this discussion. And I want to acknowledge lived experience of any of you on the call today. It's so useful, and I will just also make the point that this particular initiative is one of a number of initiatives that we're working on, and has really inspired us not just to think about using lived experience in the conversation about life support, but also for a range of different initiatives that we're involved in. So whether it's farmers who are hosting wind farms or solar farms, to people that have been involved in resilience issues, huge natural disasters. This is now becoming a real way of doing things. So we're really grateful to Adam and Carolyn in particular for having encouraged us to take this approach, and we hope it can be used much more widely across this sector and of course others. So thank you. The next slide, please. So let me tell you a little bit about the Energy Charter. Hopefully I won't bore you to tears. I don't want to share too much information, but just to give you a bit of a context as to why we're involved in this work and why we were created. So we were created 6 years ago now. A bunch of CEOs came together from across Australia in the energy sector. There's lots of different parts of the sector, as I'm sure you're aware. You get your retail bill, but you know that there's poles and wires outside, and the people that cut the trees around the poles and wires often are not the people that send you the retail bill. And then there's people all the way up with, you know, whether it's coal-fired or increasingly renewable wind and solar. So all of these different players came together and they said, we've got a problem. We're not doing what we need to be doing for customers and communities, and we as individual CEOs and businesses want to work better on that. So we co-designed with a number of customer and community members 5 principles, and they're set out there on the screen. Really the most important one is just putting customers and communities at the centre of the business and the centre of the energy sector, which is nice glossy words on a page, I'm sure you'll all agree, but the doing it part can be a little bit more taxing. So if we go to the next slide, you can see we're involved in bringing it to life in a variety of ways. What we're really wanting to do is to get this sector together, talking to each other better, listening to their customers and communities, including people like Adam and Carolyn and others, and going, how can we work together to do better? And our Better Together initiatives are collaborative initiatives, and this is one of them, the Life Support Initiative, that bring those groups of people together with a genuine commitment to how can we do better. But it's also important to note it isn't just words on a page. We also have a very robust accountability process. So each year our signatories go through a process where they have to be accountable. Their disclosures, as we call them, they're up on our website. You can see what they're doing, what they're not doing, and what they're committing to doing better next year. And the CEOs and boards are very deeply involved in that work. So it's a pretty unique beast. And I've been here from the start, and I have a great team of incredible people. We're a tiny team, we like to call ourselves, but we're just inspired every day by the stories that we hear and wanting to do better, including for life support customers. So you'll see we were encouraged by a piece of research, which is set out on the next slide, We supported some work by the Australian Energy Foundation, who were funded by Energy Consumers Australia, so the peak body for energy consumers in Australia, to look at life support customers. And if you can believe it, this was actually the first piece of deep dive research into life support customers in the context of the energy sector in 2022. And the results were quite surprising for many of us. So first of all, we found, or the Australian Energy Foundation found, I should say, that 59% of life support customers were using their equipment to sustain their life. So that meant it was incredibly critical for their life and their quality of life. But what concerned us the most is these next couple of statistics that you can see on the screen. So almost half, or a little over half, of life support customers didn't have a backup plan. And that's really, really worrying when you consider that only 7% had access to backup power. And Elizabeth's mentioned at the beginning the folk in Broken Hill, and I think many of us, will obviously be very, very conscious of the events over the last couple of weeks in Broken Hill. But we'll also remember things like the Lismore flood and other natural disasters. And the reality is that the energy sector, and Mike from Essential Energy will talk about this in a minute, they can't just put the energy on in 2 hours when you've got something at that multitude and scale. So when there's a huge flood, of course, that has implications for being able to switch power on. We had almost 70% of these life support customers thinking that they would get power restoration within 2 hours. And of course, in many cases, that's just not practically possible. So based on this research, if we go to the next slide, we identified pretty quickly there's an opportunity, right? There's an opportunity here that certainly the poles and wires folk, of which Mike's from, and energy retailers realise we need to do better. We need to be focusing really on the critical life support customers, those that have critical continuous energy supply. That's quite a mouthful. Some lawyer would have come up with that, I'm sure. In the home, and we need to make sure that those people are really targeted at a time when the power goes out. So what we've been doing before we even got to the lived experience panel was we worked with people like John Zorbas, who will be speaking to you shortly. We worked with a medical advisory group, and we had a number of doctors speak to us from all parts of the country about what they were seeing in their practices and hospitals in terms of life support customers, and what possibly was a better way to be looking at how do we define life support customers. But we also realised pretty quickly that we needed to hear from life support customers, and this is of course where Adam and Carolyn come in and the incredible work that they have been doing, but also a massive thank you to CHF, who supported us, because I have to say that as a small organisation, while we were so excited about doing a lived experience panel, we needed a partner to do that with, and that absolutely was Elizabeth and her team, and so we're very grateful for the support. We've also been working with what we call a customer outcomes group. So this is a number of energy and health consumer representatives, and they've been looking at it from the perspective of how does this interact with energy concessions and other things that operate in the energy sector. So I guess just to summarise, I'm conscious of time. For us, this was such a critical way to move forward. We identified a problem, a really significant problem, and I can see some of the comments in the chat. Absolutely. We identified a process to better understand. I think this is a sector in particular full of very smart engineers that want to come up with solutions, but that criticality of talking to people that are actually living with the experience or trying to help, in this case, these customers, which of course is a medical profession, was critical. So very grateful for the collaboration and the support, and also grateful for the fact that this incredible initiative has sparked lived experience panels in many of our other Better Together initiatives. I might leave it there, Elizabeth. Thank you so much.
Fantastic. Oh, fantastic. Thanks so much, Sabine. And I love you all to share some Fantastic. You're all very organised there with your emojis. Thanking Sabine for her terrific presentation and the recognition of the importance of hearing from those most significantly impacted, in this case, people using or relying on medical equipment, and what it might mean if the power goes off for them. That's really terrific. I'm going to now throw to Carolyn and Adam, and I'll start with Adam last time, so I'll go to you first, Carolyn, and then Adam, and just ask you, what you thought of what Sabine said and what it brought up for you, just a couple of minutes perhaps, and then we'll move on to our next speaker. Thanks, Carolyn.
Thanks, Elizabeth. Yeah, I think, I just think it's fantastic to think that, I think it's almost 19 years now since I lost Danny, to think that all of that time has gone by, but this issue is still really present for people. And obviously with Broken Hill and Lismore and all of the things that communities are going through or will go through as well. I think that this opportunity to put this issue on the agenda is really, really great. And I'm really glad the Energy Charter, is able to bring a lot of the retailers and suppliers and people involved, as well as us people with the use, the experience of using these life support equipment. I think, yeah, that's really great that work is being done now. I mean, it's not before time, but it's time that we all take action. And I think, we can all get involved somehow. So I think it's really great that the Energy Charter's been able to work with Health Consumers Forum. And I must also mention the Energy and Water Ombudsman's work as well, because I think that's how I really got involved in the systemic issues to do with the energy sector. So I must give credit to the Energy and Water Ombudsman, who invited me to be a guest speaker a number of times about my story. And so, yeah, there's been a variety of different things happen in the space. Not just this one, but also in terms of the concession space. But we can maybe come to that later on, Elizabeth. But I think Sabine was a great speaker, and I think she explained what the procedures are happening and all the processes and things that are happening. So yeah, hope the audience is getting a feel for all the different things that are happening.
Great, thanks. And Adam, I'll just throw to you now. Any thoughts following Sabine's presentation?
Look, I hope that it is a call to action for everybody, because what I note these days is that words like resilience are dropped into sentences, but they're not nouns or proper nouns. They should be verbs for doing things. And we now do have the rule change. So I call on everybody who requires life support equipment, knows someone who requires life support equipment, or is the carer or is the doctor to somebody who requires the support equipment, to download the medical backup plan, to advise your friends, your patient, your family about the urgent problem of only 7% of people having backup power and very few having backup plans, because these are all things that it is within our wit and the technology and our planning and administration to fix. And I think we need to sort of rest on that point. Everything that we have been talking about this afternoon is within our power to fix. And there does not need to be one more death out of this at all. We need to acknowledge that there will be power outages. That is the nature of the beast. That is the nature of the climate change and climate adaptation that we have to face. But I am convinced that there should be a position very soon where we can say there is no need for anyone to die from a lack of power. We need them to put in their medical advisories. We need them to have a backup plan and backup power. This can be done, but we all need to act on this urgently, because as Broken Hill has shown us, this is real. and that on its own should be a call to action.
Yeah, thanks so much to Adam and Carolyn for their wisdom and their sharing those important views. Getting some more claps and love there in the chat. Thank you. Loving your work, chat. Keep it coming. So now we're going to move to our next speaker, Mike Cole. Mike is the head of customer service at Essential Energy, and you can see Mike's wider bib bio in the chat. Shannon will pop it in there. So Mike is here to provide us with the industry perspective and experience of what happens when there is a blackout and how they work with customers, life support customers during this situation. So really looking forward to hearing the industry perspective. Thanks so much, Mike.
Excellent. Thank you, Elizabeth. Afternoon, everyone. So Mike Cole, Head of Customer at Essential Energy. Firstly, I want to acknowledge the land of the Gabi Gabi and Jinibara peoples, which are the traditional custodians of the land I'm dialing in from, and pay my respects to their elders past, present and emerging, and indeed any Indigenous people that are joining us on the call today. Thank you for joining us. I feel privileged to join such a wonderful group of people and want to thank both CHF and the Energy Charter for pulling this together, but also so much of the work that's occurred as a part of this Better Together initiative. And to both Adam and Carolyn, yeah, every time I hear your stories, I just need to thank you for your bravery and the amazing work on the lived experience panel that you've undertaken. I mean, it takes a lot of courage to share your stories, and the work that you've put in has ensured that we're going to have a much better outcome for consumers. So as the speakers have mentioned before, and can we please move to the next slide? So as speakers have mentioned before, climate change is creating more natural disasters, which in turn inevitably will result in power outages. And this impacts networks like Essential Energy's greatly. To provide some context, Essential Energy looks after the poles and wires across about 95% of New South Wales, and to some very remote areas where the network is mostly above ground and exposed to climate impacts. So what does that mean? It means that there's circumstances where we will see increasing climate-related power outages. And while we're working to minimise this disruption, of course, we can't ensure 24/7 power supply. And I think some of the statistics from the Australian Energy Foundation research that Sabine provided before kind of set the context around the broader issue with that, and a call to action, which of course, helped develop the Better Together initiative. I think in addition to that, we see from a health perspective that there are a growing number of Australians that are choosing to receive hospital care at home, and also are choosing to age in place, which are both considerations for us as an industry, but also as a community, to ensure that they're aware of the issues that I just described, but also what's available to them and how we can provide support. Next slide, please. I'm sorry. I'm back. So the Better Together, I just want to give a shout out to my industry colleagues, which you can see on the screen, and also the co-lead South Australia Power Networks that has worked obviously with Essential Energy, but everyone on the screen, and also the lived experience and medical panels and other consumers and advocates, including the Justice and Advocacy Centre. So thank you very much. We move to the next screen, please. So Sabine talked about the Better Together at a high level, and I think Carolyn covered off a couple of these as well, but I might just run through what does it actually look like or mean. So of course, the redefining of the life support customer definitions through a regulatory proposal. So as an industry, we have some rules that govern us, and we need to put proposed changes to those rules in. And so that's been submitted. And the next steps for that rule change is it will open up for consultation for anyone to submit any feedback around the proposed changes, which include the kind of the key aspects are that move to define critical life support customers, but also assistive life support customers, those that require supply to a power and medical equipment that utilizes that power to assist in their life. So that will be open for consultation, hopefully within the next few months, and there'll be a bit of a process that'll run there before anything will be put in place. The other important aspects is the co-development of the medical registration process to have a uniform form that's used across and a process across the country to ensure that both consumers that are having to go through the process to talk about medical registration and their GPs or medical professionals are well aware and kind of are seeing a standard template to help with that. I think the backup plan template's being talked about, but I will touch on that. So critically co-developing that. So when a customer is either talking with a medical professional or thinking about what they might do in a power outage, that they're able to have a template that's been considered previously before the outage occurs to ensure their safety, and they've got the supports in place during that outage. And to complement all of this, of course, is a national awareness and information campaign. So no point putting all of this in place if people aren't aware that, one, outages can occur and some of those statistics are corrected or changed that's been put up before. So next slide, please. So what have we done? What's the progress to date? So you can see we've been at it for some time now. We first wanted to sit down with the Justice and Advocacy Centre, who are an advocacy group, and work through. Here's some research and what are we trying to achieve together as an industry and wider community. So we kind of articulated that, and the first step was to establish the wonderful lived experience panel. Who then moved to start to develop life support definitions and start to frame up what that proposed rule change might look like. And then following that, the co-development of the medical registration and the rule change being submitted, following a bit of consultation amongst the parties that were already involved in that. We've just fired up our community outcomes group, and that kind of co-development of the backup plan has kicked off as well, along with the national campaign or awareness campaign material. So please stay tuned and look out for that. If we go to the next slide, please. So the national backup plan and awareness campaign, I think I've touched on that, but a couple of other key points. We need to make sure that we use diverse, inclusive, wide-reaching type communication strategies, both digital and non-digital, to ensure that we're getting as much cut through as possible and reaching everyone. Of course, we want to target those life support customers, but also their carers and support people and the medical community and advocates that could help us get the word out. And of course, then talk through what the next steps would look like once those rules are put in place. But we don't need to wait for that. Everyone can be thinking about backup plans and having those conversations either for themselves or with friends and families or others in the community. And I think it's on the next slide, might be my final slide, bit of a call for action. Yes, how can you help? So please provide us with feedback. So there's a bit of a QR code there. I just noticed the dinosaur, that's fantastic. Or you can go onto the Energy Charters webpage. So once we get that kind of co-design backup plan and awareness campaign out there, we'll obviously be seeking some further feedback on what that might look like. So I might pause there and back over to you, Elizabeth.
Thanks so much, Mike. You can see you're getting a lot of love there in the emojis. I hope you're appreciating that. That was really useful to get the sense from what's happening in the broader scheme of things and how the work of the Lived Experience Panel and the Energy Charter is all coming together to really support those people who rely on energy in order to run incredibly important medical equipment for themselves. And Adam and Carolyn, I'm going to start with you, Adam, and then go to Carolyn and say, what stuck out to you from what Mike said today?
Thank you very much, Elizabeth. I think it's very important for everybody to pick up the offer. I mean, the energy companies have gone out of their way to set up, to endorse, to fund, and to continue to support this process with a great deal of goodwill. They've been prepared to take on all the learnings and critiques that we and other consultative bodies have offered. And I am left feeling very positive that this will indeed generate positive outcomes for people with lived experience and their families, and people greatly in need of life support equipment. And as I've said before, then there is no need now for anybody further to die because of a lack of power. We have a system and a proposal that is being rolled out that will ensure, I am confident, that we have a robust system so that the people in need can be identified, their support needs identified, and plans be made so that they know what they need to do, what their loved ones need to do in the case of an emergency, so they have a backup plan, and hopefully they also have access to backup power or a battery to tide them through until the power can be restored, and they can be confident that that restoration can now reasonably be triaged, because we have worked out the hierarchy of things that need to be done, and the lists of life support customers are manageable and strategic. Having said that, our lived experience committee was very conscious that all parties currently on the list be reassured that we weren't kicking people off lists, we weren't trying to leave people behind, we were trying to appropriately manage resources, aiming at the people most in need. That is why we have the two definitions, acknowledging that there will be people with immediate needs and acknowledging that there will be people with serious needs that need to be dealt with urgently, but we must deal with the life and death instances first, where people are absolutely reliant. So again, I am very positive about where this process is going. I'm very enthusiastic and hopeful about the outcomes it will be able to bring. Again, from my own lived experience, I know that there will be power outages, but I am hopeful that with the work we have done and the work that the Energy Charter and its supporting energy companies have been willing to do, that there will be a lot of improved outcomes and better results for those most in need.
Great, thanks, Adam. Thanks for that. And Carolyn, any thoughts from what Mike said?
Yeah, my video is not able to be activated at this point, Elizabeth. So Shannon, maybe you can do that for me. But yeah, I think I just want to thank Mike and all of the people who are signatories and involved in the Energy Charter and involved, signed up to that, because I think you know, every energy company really should be involved, and you know, we should all be working together. And I think it's just the right thing to do. And I'd just like to thank Mike, and also I think it was South Australia energy company or what have you. Sorry if I don't get the name right, but I think they're leading the way in terms of these kind of social justice initiatives, and just, you know, really listening to customers, which, you know, let's face it, every organization, every business really should be doing. So I'm really quite chuffed to be involved in this space. I think there's some excellent initiatives happening, not just in the life support space, but in this instance, that's what we're talking about today. But there are a range of other fantastic initiatives that the Energy Charter is working on with the energy companies. So thank you very much to all of those people, and a call to action to all of the other energy providers. I noticed my power company's not on the list, so I better get onto them and give them some feedback. But yeah, I'm not sure, Elizabeth, if we have time now, but I've come up with some ideas I just wanted to share with people about emergency backup power that I have now access to. And so I think if you would like me to share that now or perhaps later, I know that we only have half an hour, so I just want to quickly share that, but I'll wait till you let me know.
Yeah, we've just got one more speaker, and I think then I might come back to you as the first question, and you can share that before we go to the rest of the Q&A.
Yep.
I would just, I'd like to introduce our next speaker in a moment, folks. We've had lots of questions in the Q&A. I want to shout out to John Stosser, who's put in heaps of really great questions. Well done to you and others as well. And also a huge thanks to Sabine, who's been busy going in there and where she can already providing some answers. So if you haven't asked a question, pop it in there. We'll be coming back to the Q&A really shortly. But now I want to mention two other people we're going to add to our panel. We've got Dr. John Zorbas, who's a specialist emergency and intensive care physician at the Royal Darwin Hospital, and also Sophie McRae, who is the head of customer experience at SA Power Network. So really welcome to you both. And before we go into Q&A, I'm just going to throw to John for a moment and say, can you give us a bit of a sense of what it's like for you and your colleagues when you're in ED and the local area goes through a power outage? What happens in your environment? Thanks, John.
Yeah, thanks, Elizabeth, and thanks to everybody who's spoken so far and for the stories that we've shared. It's an interesting place, Darwin. We're in the brunt of storms more often than not, and so there's been a few times where we've had to fall back to backup power in the hospital and the surrounding region. When Cyclone Marcus came through in 2018, I didn't have power for about 6 days. And in the hospital, it's interesting. Nobody wants to have to go to the emergency department. Nobody has a good time in the emergency department, and yet it is the catch-all for our disasters. And for the first, day or two, people might get by, but by day 5, day 6, you've totally saturated all your local resources. Now I've got the luxury of a large city. We move out to the regional areas, and we saw this with the Lismore floods as well. You hit capacity within a day or two. And when we've got a system in place that doesn't allow the power companies to be able to prioritise, as Adam has highlighted, the difference between critical and important, it can be almost impossible to work out where you need to divert your resources to. And there was a question in the chat around, the ability to triage those resources. I wouldn't be able to do my job in an emergency department without the ability to prioritise. And I think the work that's been done so far on this is incredibly important to make sure that we get the limited resources that we have to the right place at the right time. To answer that question, Elizabeth, in short, the longer the outage, the more impact it has on local health services, and they too, in turn, get saturated to the point where even we need backup plans for our backup systems. General practices that don't have batteries or power support systems in place, suddenly you don't have access to patient records, and really just highlights the importance of a backup plan. Let's get our systems in place while we have power, so that when we don't, we can rely on that to get us through.
Fantastic. Thanks so much, John. And you're getting some love now. I hope you can see that. Difficult job being on Larrakia land and not having power. I appreciate that. And as you said, in a way, that's the easiest place, because as you move out into homelands and other areas, even more challenging when the power goes out. we're going to do our Q&A session now. We've got about 20 minutes or so to do that. I'm going to start by asking Carolyn to share her ideas about backup plans. Then we'll go to the questions that are in the Q&A, particularly those that haven't already been answered. So if you've got a question, pop it in now so that we can make sure we cover it off. So Carolyn, let's go to you first, and you can provide us with that really important wisdom we wanted to share just a few minutes ago.
Oh, thanks, Elizabeth. Yeah, it was just sharing what I've come up with my solution for next time the power goes out. We have a small, we live in strata, like a villa, so we can't get solar panels on the roof, unfortunately, but we have bought a small portable solar panel, basically, that sits out on my back patio. And yeah, my lovely partner Steve, who I met sometime after I lost Danny, he's been able to use his little engineering genius that he has. Not I can't take credit for any of this, but basically he's run that solar panel, which cost about $200. He's run that into our garage, and we bought a battery to store the power. So when it is sunny, all of the battery fills up with solar energy, and that then now is the only really important device. I mean, everything's important when the power goes out, but for me particularly, the BiPAP machine that helps me to breathe when I'm asleep, and means that I can't really go to sleep if I don't have it. And certainly if the power goes out while I'm asleep, it's a very big shock. We've actually been able to plug that now into a power socket that we've had put in our room, and then so we can use that solar energy, and we think that will last for around at least 12 to 15 hours, which is plenty of time to be able to get myself to somewhere that does have power, or to continue the night's sleep until the support worker arrives the next day. So that's just a little solution that we were able to come up with, that doesn't involve, petrol and what do they call, generators and all of those difficult things. But yeah, I just wanted to share that as to people to looking into those things. If someone's got someone in their life that is a bit of an IT, bit of a engineering guru, or can do some research on Google, there's certainly ways now that you can come up with some at least emergency initial power that might not help Adam in his 5 days without power, unfortunately, but it will help for at least a few hours to keep things like ventilators or oxygen tanks running, and so forth. So I thought I'd just share that idea with people.
Fantastic.
I'm sure there's other great ideas out there as well.
Yeah, that was fantastic, and a lot of appreciation there in the chat for that idea, because this is about sharing too. The whole process of co-design is all about sharing our knowledge and our wisdom together in order to reach better solutions. So really terrific to have you share that. So now we're going to move to our Q&A session. And so I'll ask all of our presenters to put their cameras on, because I'm going to be asking them some questions. So you've got to wake up now, folks. And let's start with a question. We seem to have, when we've looked at who's here today, there's quite a few organisations, some of CHF's member organisations, so big shout out to all our members, and others who are involved with working with consumers or people who are using medical equipment, or perhaps caring for people who use medical equipment. And really interested to know, and I might go across all of you and say, if there's one thing you could give as advice to people who are working in consumer health organisations about what's the best thing they can tell or do or to support people who are life support customers to prepare for blackouts. So let's get some really great ideas going on here. So I'm going to start with you, Sophie, because we haven't heard from you yet. You've got one good thing that you'd like to share with Consumer Peaks, the one thing you'd love them to do.
Yeah, sure. Thank you, Elizabeth. I won't say backup plans because I know we've covered that a lot, and I'm sure some others will mention that. What I will say, and it's one of the items that is in our sort of draft life support rule change, is around secondary contact people for life support customers during power interruptions. So for SA Power Networks and many other distributors, that's part of the rule change to sort of make it part of the registration process up front. But right now, customers can register with us secondary contact. So it's a separate process. It doesn't happen automatically when someone signs up for a life support registration, but it can be done via our website and our call centres. So putting on an extra contact person, we take up to 5 extra contact people if needed, so that when there is a power interruption at your property, multiple people will be notified.
Right, that's really fantastic advice. Mike, I'm going to ask you, because I'll get the industry perspective first before we move on to the consumer perspective. One thing you'd like to share with organisations working with consumers that would be useful for them to do or say or support?
Create awareness. Create awareness that this is an issue. And Sophie, I'll mention the backup planning, that you need to have a plan in place because power outages will happen.
Fantastic, thanks. John, what about you from a clinical perspective? What's one thing you'd like to share with the consumer health peaks?
I'll say rehearsal. I think depending on where you live, if your backup plan ends in attending hospital, it's good if your pre-hospital service, whether it's ambulance, staffed, volunteer, a remote clinic, knows what your device is, that you have the device, that you have X hours or minutes before you need help. If they know that locally, it can help them to be able to prioritise their response. And all emergency departments around Australia will have patient management plans that we can develop on a personal level. That's usually not very obvious from the hospital. The bureaucracy of hospitals, I'm sure everybody here is aware of just how much red tape there is in hospitals. But if you reach out directly to your local emergency department, it's often a lot easier for us to work with people on a one-on-one basis to know your needs, so that when you do get to the front door, we're not starting from scratch. In the same way that lived experience has informed everybody here, that rehearsal and being able to, the power going out shouldn't be the first time you have to go through your backup plan.
Yeah, fantastic. Thank you. So I'm going to go to you, Adam and Carolyn, and I'm going to come to you last with the same question, Sabine, okay? So Adam, thoughts, what's one thing you want to share with consumer organisations? What should they be working with their consumer members about?
I would say quite sincerely, and I know people have concerns about privacy, but I think this is a point beyond privacy. I would give your backup plan to everybody that you potentially need in an emergency. This includes your doctor, who you should have consulted with about it, but it also includes your local emergency hospital, like John has just mentioned, so that the key providers, the key care organisations that are in contact with you know what the plan is. It is on your file. They can readily access it if you appear or arrive in their service during the passage of an emergency. So, do not be shy about this. This is a matter of life and death. So please do tell everyone you need to interact with that this is what I plan to do in an emergency, in a power failure, so that everybody knows you could turn up, including in the emergency ward. Hopefully, this process will allow you not to turn up in the emergency ward as the first point, but wherever you need to go, that the person at the other end can be prepared for your arrival.
Fantastic, Adam. Carolyn, thoughts?
Thanks, Adam. Yeah, and thanks, Elizabeth. Yeah, I think conversations, just having conversations with people in your life. So conversations with your neighbours, they're going to be the first people probably that can get to you. Get to know your neighbours. Be a friendly neighbour. Those kind of strategies. You get to talk to your professionals, like your respiratory or dialysis professionals. Whatever specialists are prescribing this equipment, ask them about backup plans, about what happens when is there a backup battery? Know about if you can buy a backup battery. Make sure you have conversations with your family so that they know, what to do and who to call and where to go when these things happen. And just making sure that you have good information around your house about what to do, that you have one of those things that has your mobile phone what's it called, like an extra power battery, so that, you know, you can't do much without your mobile phone anymore. So if your mobile's flat, you know, that's no good. So just all of those practical things, and they all go into your backup plan. And I know it's not just about that, but I think having conversations about it with everyone involved and hearing what other people are doing, you know, get ideas from other people. You know, I would never have thought of the solar panel idea. It was just that Steve had an interest in solar panels, and, you know, good on him, because that's helping us know that we have a bit more peace of mind and a bit more time up our sleeve if, you know, and when the power does go out, because we all know it will. Yeah.
Fantastic. And Sabine, what's the one thing you want to share with consumer organisations today?
I think it's about encouraging actually friends and family. So, you know, often there's just so much onus on the customer or the patient or the life support customer to kind of be doing stuff. But it's also up to friends and family to really support that person in getting the right network around them and the right sort of supports. And there's been a great example in the Q&A. Anna Birchall's just written about EVs, and of course electric vehicles, many of them do have batteries that could then be used as a backup battery, and suggested, well, no, she's even doing it, which is even better. She puts her EV on the local community Facebook page for Essential Medical. I mean, that brings tears to my eyes. That is what this is about, right? We cannot rely on industries all the time to be able to kind of help us out when there's something like a huge flood or broken hill. So that kind of community spirit, you know, amazing. Thanks for that really inspiring example, Anna.
Great, thanks, Sabine. Now then, Joe had a question in the chat about meters, and I think, Mike, you're happy to answer the question about the smart meters and whether it helps with the recognition of life support customers. Thanks, Mike.
Thank you, and thank you for all the great questions, Joe, and some technical ones. And I might throw over to you, Soph, after I respond from a New South Wales point of view. In some other jurisdictions or states, smart meters have rolled out and have been in place for some time, but in New South Wales, they're just picking up steam around rollout, and the plan is to have them kind of rolled out over the coming 5 or so years. But smart meters have a lot of benefit to households. Unfortunately, one of them is not that we understand if someone's supply is on or off at that point in time to be able to act. So unfortunately, we don't get that data through as a network as such. Thank you.
Great, thank you. That's really helpful. And if you haven't been looking in the Q&A, there are lots of answers to the questions in Q&A, at least some of them. So good for you to have a look at that. Sophie, have you got anything to add to Mike's comment from the South Australian perspective?
Yeah, just we're very similar here in South Australia. So just over 40% of our meters are smart meters now, but we don't get real-time data from those meters. We don't own or operate them, so we don't have that visibility at this point in time.
Right. I'm going to ask you one more question while I've got you, because Joe's asked a question about, I suppose, cross-industry collaboration, and said, you know, can the scope of multi-hazard backup plans include all utility types? Power, water, gas, phone, internet. Is there any movement across these kind of various parts of the sector to come together? Because, of course, for the person experiencing it, it's the one experience. It's not siloed. I've got a problem with my gas, or I've got a problem with my internet.
Yeah, I think it's a really good question, and I might get some input from Sabine in a minute if I've missed anything through the work the Energy Charter is doing. The rule change that we're sort of proposing and the life support register as it stands is only in the electricity industry. So from that point of view, that information wouldn't be shared with others, but it is something we've sort of been discussing, whether there's something at a state-based level for other emergency services or other utilities to sort of start pulling together and making a difference for those customers, because we do know, especially in rural areas, when there's lengthy outages, often the mobile data goes out, so people can't use their phones and things like that, which you know, puts a lot of strain on life support customers and communities in general. So, you know, Sabine, if there was anything you wanted to add to that.
Yeah, well, I've certainly been discussing this a lot with NBN Co, having worked there in the past. And of course, it's a little bit different for them. They have backup batteries that sit within the device. They're much tinier because they're obviously not powering a whole home. And what we are starting to see from Telstra's and others is trying to use some of their mobile towers where they already have batteries in situ as somewhere where the community could go. We've noticed a really interesting idea would be partnering even with companies like Woolies and Coles and IGAs, who obviously have locations within many regional areas, and often will have generators because they've got so many fridges. So they've got the generator in there, and them really opening up to the community a community service, which is, we do have power here, please come. And probably mobile phones are going to be one of the critical things for many people. But I've heard in Tasmania, for example, utilising fridges for things like medicines that need to be refrigerated, etc. So I think part of this is absolutely, as Jo's pointed out, reaching out across sectors. We need to get ours a bit in a bit better shape at the moment, but we are really keen to work across sectors, as you've identified, Jo, so thank you.
Mark, you want to add a
Sabine
comment?
and Xavier, and I think I might point out, I mean, across the sector, particularly when it comes to kind of the mobile phone, which has internet on, we're making investments, particularly essential energy, in things called portable SAPs, the standalone power solutions, which we can take into communities when there is extended power outages, both to support our crews on the ground, but also for customers to be able to do things like charge their phones to be able to get onto their insurers and other critical calls that they need to make, but also couple that with things like Starlink connections as well. So people can jump on that Wi-Fi and make contact with the outside world often in those kind of scenarios.
Right.
And
Thanks.
I also want to add, I think it's a really good call out, and perhaps we should consider at least might be a kind of path of least resistance to get people considering this, that on our backup plan, we should have something that says, have you considered not just energy, but also X, Y, and Z as a
right.
part of this? And that could be an easy way to get that conversation going.
Yeah. And Sabine, I know you put something in the Q&A about this, but I think it's worth sharing the work that the Energy Charter does to advocate with governments about who set a lot of the rules around life support. Can you talk to us about what engagement you have to really advocate for people who are reliant on life support equipment?
Yes, thanks, Elizabeth. So the work that we're doing is obviously through this Better Together initiative and with the use of the rule change. So the rule change has gone into the Australian Energy Market Commission. They're the rule body for energy, quite a mouthful. And they are considering this. It will go through a very independent process. So really encourage people, if you're enthusiastic about this, please put on submissions, and perhaps, Elizabeth, with your help, we could, notify people when that process is live. And really what we're trying to do is create a platform where both consumer, lived experience folk and also those who are on boots on the ground in these emergencies are able to really advocate what needs to change. And that's the purpose of this. And I have to say the feedback, from regulators, from governments has been incredibly positive. I feel as though, just a personal view, that this has sort of sat under the radar for too many years. And that's not because anybody was neglecting it, but just perhaps because people weren't as aware as they should have been. It's now absolutely front and centre. So this is a critical conversation to be having, and we're just so grateful that everybody's, really coming together to give those different perspectives, because I think everybody on this call would agree, we absolutely need to do better, and we can only do better if we work together.
That's fantastic, Sabine, getting a lot of love there again. We're getting to the end of the session, folks. I know you'd like to go forever, but sadly it won't. So before we wrap this up, a few things to do. You've listened to the presentation and the wisdom of many people on the call here. I'd like to do another quick poll with you and see how confident you are now in this area. So the question we've got is, after being at the webinar today, how would you rate your confidence in understanding what to know, what to do? If you're not someone who lives with the need to have access, you might now think about if someone asked you a question, would you feel more confident about answering it? Would you feel more confident about starting a conversation with colleagues at work, or perhaps a barbecue over summer about, do you know anyone? And, you know, these are the things you might want to talk to them about, or there's this thing that they can access. So just give you a moment to think about that. And then we'll pop the answer up there for everyone to see once most of you have done your poll. Just while we're getting that organised, oh, there you go. Thanks so much, Shannon. So most people feeling more informed, some feeling like they knew most of that before they started, and no one feeling they're worse off. It's always a good thing to know. If you want to stay up to date with all things to do with consumers, we really encourage you to subscribe to the CHF newsletter and follow us on social media, whether it's Twitter or Facebook, or I still call it Twitter because I'm old school, or LinkedIn, wherever it is, so that we can share this and other opportunities. We have lots of really fascinating webinars, and that's where you find out about them. Our next one is actually only in a couple of weeks' time, on the 28th, and it's about the digital health record. And my health record is really important for you to know about, again, especially if you're reliant on medical equipment. And Dr. Zorba's talked about making sure people know what you need. That's one way, is having that shared record, so someone can open that even if you're not awake and see what's going on for you. I really like to thank everyone, fantastic speakers, particularly to our consumer advocates there, just so amazing. And let's put some love in the chat for everyone who's joined us today. Sophie and John, Sabine, Mike, Carolyn, Adam, who have I forgotten, and also the amazing CHF team, Ben and Shannon, Morgan, all those folks getting us organised for today, so helpful. I really like to thank you for joining today, because it's such an important message. And my challenge to you all is that the first social event you have as the summer starts, do have that conversation. Actually have a think about just starting this conversation randomly with folks, because there will be people in your circle that are reliant on this equipment, and perhaps it's never entered your head that this could be an issue, or those you know might have someone who would really benefit from knowing some of this. So a few people talked about the importance of awareness, and Adam has made the point really strongly that no one needs to die, but people need to know what to do. So let's make sure from today, one of the outcomes is we all commit to making sure at least one other person knows what to do should they find themselves in a situation where there's a power outage and somebody needs some help. So we're going to leave you with a slide on the screen now with some I can statements to give you some ideas of what you could do. Remember that this is recorded, and we will share the link to this with you shortly. So if you're an organisation, you can share that link then and put it in your newsletter or up on your Facebook page personally if you think it would be useful for the people in your social group. You can share it widely. Love to have 10,000 people look at this over the next 12 months. And we will keep our webinar open just for a few more minutes in case you want to put anything else in the chat. You want to read through those tips with the holding slide. And I'd like to just again, from my heart, thank you all for being here today. And we will make sure that we send a recording of the webinar to you shortly, and it'll be on our YouTube channel. So thanks so much, folks, and stay well.